Topic is thigh and ischiorectal abscess. Thigh and ischiorectal abscess. So, dear students, we'll discuss a clinical case. It's very commonly seen, especially in elderly people, bedridden patient, diabetic patient, those who have metabolic problem, neurological problem, and so on. That is, look at this. Look at this. See that redness is there, induration is there on examination. So that localized swelling is there. See that? If you palpate in this patient, suppose you palpate warmness, tenderness, swelling, calor, dollar, rob, rebot, tumor, you know the features of acute inflammation with the suppuration inside. And it will get localized, suppuration occurs. So it's a typical feature of an abscess actually. So the ischiorectal and thigh abscess in a diabetic patient, such things are common. Multiple is common in diabetic patient, elderly people, like HIV patient, immunosuppressive individual, those who are on long-term steroids, those who are bedridden, those who are having other sepsis. So, the different causes for multiple abscess in the body. And you know the definition of an abscess. Abscess is localized collection of pus in a cavity lined by granulation tissue covered by pyogenic membrane containing pus in localized. Very word is important. Word localized is very, very important. The starting word for definition is important. It's a localized collection of pus lined by granulation tissue in a cavity covered by pyogenic membrane containing pus in locale. The entire definition, each words are important when you define an abscess. It's important. And see that all those features of inflammation I have told. There is skin necrosis. Eventually, the skin necrosis occurs in an abscess which has gone, when you don't drain it, when you don't treat it. So, diabetes management is important. Browning induration is very typical. Remember, mobility should be checked. Warmness. I have told all those things. Start the broad spectrum antibiotic. Evaluate the patient for diabetes, blood count, CRP, and other metabolic causes. Then, if there is patient on sepsis or septicemia, resuscitate the patient, give proper broad spectrum antibiotic intravenously. Of course, admit the patient and drain this abscess either by spinal anesthesia or general anesthesia. Make adequate incision, often cruciate incision, and so that it won't close properly. It would be kept. Wound will be kept open. Incision will be kept open. So, in such situation, cruciate incision. Depth of incision is also important. Length of incision is also important. Drain all pus. Send the pus for culture sensitivity. Curate properly. Give a good warm saline wash. Pack the cavity. This is what exactly is required. So, pus is sent for culture sensitivity and continue the antibiotic. Correct the diabetes. Maintain the nutrition. Improve the mobility. Give a physiotherapy also. Prevent the recurrence. And complications are fistula, osteomyelitis, the deeper bone like ischial bone, and sinus formation, recurrent abscess formation, sepsis, and so on. All this is a cruciate, typical cruciate incision which you have to use in such situation, deep incision, so that it won't close actually, drains, continuously drains. So, ischiorectal fossa, what is it? A pyramidal shaped space it is. It got a limited fascia, it got a parietal area, laterally obturated internus, internal sphincters. Very, very cruciate areas, very important area, very crucial area. This two spaces are located one on each side, which communicates often with each other. Let's say fistula when it occurs, often it's horseshoe shape. So, anatomy, all cause canal is very important in the brain. When you drain ischiorectal abscess, there is a this with a pyramidal shape where it different boundaries, pudendal, vascular bundle, all cause canal, all the things are important as far as MCQ is considered. So, these are the different problems of the ischiorectal abscess. Of course, ischiorectal abscess can cause fistula. Thigh abscess can cause sinus formation, osteomyelitis, and so on. Because fistula, which is often communicated with the rectum, that is why it is, can cause fistula. So, that is also detail about ischiorectal abscess, thigh abscess. Read infection chapter in my established manual surgery where abscess is given in detail. It's a main question. Drainage of abscess. Hilton's method of drainage. Lister sinus forceps is usually remember Lister sinus forceps does not have a lock. So detail abscess management is the main question. Operative surgery, Viva also they will ask. So go through my manual for chapter swelling, chapter infection. It is given in detail, and also ischiorectal abscess is given in the rectal chapter in detail about the different types of ischiorectal abscess, why it happens, cryptoglandules, causes for ischiorectal abscess, how to drain it, what is the force, etc. force are. Cruciate incision is important. Everything is given in my manual of surgery, and the clinical pictures are the clinical methods in surgery. So I have purchased the both books and have that read, have the better knowledge. And also I request everybody to subscribe my YouTube channel for daily update of their knowledge in surgery, briefly for 5 to 10 minutes about instrument, clinical cases, X-rays, images, operative procedures, and so on. And also press the bell and also share with your friends and colleagues. And also once into which join the live session of extensive discussion of different clinical cases with the senior professors online. And also again, please subscribe my YouTube channel. I request students and go through this MCQ, put the right answer. Common type of endorectal abscess is ischiorectal, perianal, submucous, and pelvirectal. Put the right answer. I'll appreciate and acknowledge your answer, students, in the comment box. Most common causative organism for anorectal abscess is E. coli, Bacteroides, Streptococcus proteus. Again, put the right answer. I acknowledge your answer. Quotation of the day is accept what is. Let go what was. What was that? It's past is history. Uh, Future is mystery. Present is what you are doing, what you are facing. So concentrate on the present. Future won't have a plan. You can plan your future, but you won't be knowing. Past it is done. Is the past is over. Past is so future is mystery. Past is history. Remember, accept what is. Let go of what was. Have faith and confidence in what it will be. So future, have a confidence on the future. But what is today, you go through it properly. What it was, forget it. So that's what exactly this quotation again very very useful for all surgeons. And again, I request students to subscribe my YouTube channel and have my manuals of surgery and clinical methods in surgery. Students, I hope you have understood this lecture very well. Thank you so much.